Hello, our group project was on MRSA. My name is Guadalupe Lopez.
My name is Nhi.
And my name is Solomon Adjei.
So the name of our pathogen is S. aureus, which stands for Staphylococcus aureus. It is a biological nomenclature and is a type of bacteria found on the skin. And it sometimes can be harmless, but it can cause sepsis and even death in serious cases. Here's a picture of the gram stain and the morphology, which is basically a staphylococcus, and it's a gram-positive bacteria. The mode of transmission of MRSA is spread by contact from another person who is contaminated or things that are contaminated, such as sharing items like needles, razors, or any personal items that are contaminated with the bacteria. Also, MRSA pneumonia is a mode of airborne transmission. If a person who has MRSA pneumonia is coughing, it is possible for it to spread, and it is important to take contact precautions to prevent the spread.
Major signs and symptoms of MRSA is a pump or infected area on the skin that may be painful, red, leaking fluid, or swollen. The pump under the skin that are swollen or firm. The skin around a shore that is warm or hot. The pump get bigger quickly and doesn't heal. Pain sore along with the fever, rash, or fluid-filled blister. So how do the bacteria do damage? MRSA is caused by a type of staph bacteria. The bacteria are generally harmless. However, with high level of staph, it can cause infection. When as areas invade to skin, it can lead to localized skin infection like pimple, which can evolve into furuncle or boil. MRSA infection can resist the effect of many common antibiotics, so they are more difficult to treat. This can allow the infection to spread and sometimes become life-threatening. MRSA infection may affect your bloodstream, lung, heart, bone, and joint. The mortality rate study from CDC show that about 1 in 3 people carry S. aureus bacteria in the nose, usually without any illness. About 2 in every 100 people carry MRSA. For MRSA patient, the mortality rate is from 20 to 50%. According to CDC, there are nearly 120,000 Staphylococcus aureus bloodstream infection and 20,000 related deaths in 2017 in the US.
Okay, distribution, we kind of talked a little bit earlier, but MRSA is spread through skin-to-skin contact with the person who's been infected. The bacteria is usually topical, which means it's on the top of your skin, and that's the most common way of it being transmitted. Common places that MRSA breeds and cultivates and aggregates, it would be the nose, the back of the throat, armpits, groin area, and if you have wounds, it would be around that infected site. Common areas to get MRSA would be in the hospital. Other places you can get MRSA would be in concerts or close contact sports like wrestling or tennis, wrestling or football. There's a lot of treatment and prevention plans for treatment. They're mostly a combination of topical or oral treatments like trimethoprim and sulfamethoxylate, which is known as Bactrim, or you can use clindamycin, which is known as Cleocin. If you get the MRSA and it's more topical, it means it's more like there's a bigger like area of infection. You can use mepriocin, which is Bactrim, which is used in more severe cases. The preventative measures are very similar to how we're doing in COVID right now. We're gonna clean, disinfect all hard surfaces. You're gonna wash all the fabrics and all the contacts all the things you've been in contact with. If you have children, I think the best way to do would be to clean them with chlorhexidine soap and use a little bit of bleach to make a little bit stronger, more solution to clear off extra bacteria. And another step for preventive measures would be not to share personal items like clothing and towels or makeups and brushes. Next slide. Anything interesting, I guess most people that do have MRSA do go in for like little mini like surgical treatments, like little lantine, so you can drain the pus that comes from the buildup. Once you get MRSA, the chances of getting it are very slim because your secondary immune response, I believe it's your IgB or IBG or M is increased, and people that do have MRSA tend to be more hygienic after because they don't want to get the same infection ever again. And thank you for your time, and that's the end of our presentation. Thank you.